Okay guys, here we are for another think tank.
Yeah,
and
excited.
Awesome. I got Amanda Bayliss here, who, if you don't know her, you really should. She has become one of my most favorite people in the whole world.
Oh, thank you.
I was just so lucky to meet you when we moved here, and I just love you.
Oh, well, thank you. I feel the same.
I really do. So we're going to talk to Amanda because she is uniquely qualified, interested, does amazing things with cancer survivors.
Yep.
And it's breast cancer.
Yes.
Right?
It's Breast Cancer Awareness Month.
Right. Not Breast Cancer Month. Awareness Month.
Breast Cancer Awareness Month. And so...
Tell us a little bit about you. Like, how did you get... Well, first of all, what do you do?
All right. So, I've always been in the exercise fitness field. I was a college strength coach for over 15 years. And when my husband and I moved to Williamstown, he's an oncologist, and they needed someone to help build their integrative oncology department, and specifically exercise.
Right.
So due to my credentialing as a collegiate coach and my interest in cancer, I kind of transitioned my career from college coaching into the exercise and cancer field.
Right.
Cancer is also close to my heart because my husband is a survivor.
Right.
And when he was ill, he did a lot of exercise and different modalities to help in his survivorship. So that has always been a big part of our life, is having to take care of our bodies and to kind of live our life in a special way in respect to his survivorship. So
really thinking about like key things that we don't, like, we all know we should do to take good care of ourselves, but like what we eat.
What we eat, yeah.
How much we move, how much rest we get.
Yep, stress reduction. There's a big mind-body component. And so that's when I started to transition from one field to the other. Right. So right now I'm at Berkshire Medical Center, teaching 5 classes a week for survivors, which a lot of people don't know. A survivor is anyone with a cancer diagnosis.
Anyone.
Anyone.
Doesn't matter where you are.
It does not matter where you are within your cancer journey, but it's anyone with a diagnosis. You are considered a survivor. So anyone is welcome to come to the classes. They are free for anyone in Berkshire County, regardless of where you get your treatment. So
we'll put like we'll put like a little link on here.
Yes.
And you'll be seeing it right now as we talk. Yeah.
So,
yeah. And you work here.
And I work here, and I actually do work with some survivors here as well, doing a class. And it's a great way to find a new community and some inspiration and
strong survivor class.
Strong survivor fitness. Yeah.
Strong.
Strong survivor fitness.
Yeah. Cool.
Yeah.
All right.
Yeah.
So, do you want to talk about this? So last week, you were very brave.
Oh yes, last week I was very brave. I'm 40 years old now. I got my first mammogram. And I have to be honest, I was nervous. I mean, I know a ton about getting a mammogram because I work, directly with survivors all the time. And we spoke about it, talked about it, what was going to happen, this and that. But it always brings up, I think when anyone enters any room with a little uncertainty, of what the results could possibly bring to your life. And because I directly work with people all the time, I thought of them and their stories
foremost in your mind.
Yes. So I had that, and everything went well, and can I do another plug?
Yeah.
Well, of course, in this town, Caitlin Lopez is the director of women's imagery at. She's a radiologist at Berkshire Medical Center, and she was there to read. Yes, she was there to read my mammogram and give me a lot of great, helpful information and help me, to ease those nerves ahead of time.
Yeah.
So, but
she is wonderful.
Yes.
Yeah. And
yes.
And ironically, I was there yesterday too. up at getting my mammogram.
Yeah.
And because I had found something that felt weird, and Amanda was so sweet. She offered to come with me and everything. But it's a long day. And sometimes you have to get called back.
Yes.
And you have to get called back again for more angles of smushing and ultrasounds. And, you know, it's hard not to think about the scary things.
Yes,
but,
it is.
That place, you know, it was very welcoming.
Yeah.
I was texting with Caitlin, and it went really well. So last week in the BeFitNow, we have No Fear Friday. So Amanda posted quickly about her bravery last week. But she already has too many BeFitCo mugs, so I got you something else.
Oh, Robin, thank you.
So you had to get something.
Sometimes I feel like I've been abducted by aliens. So
I don't know. So this says like
these are hysterical.
For introverts, I don't know. Not saying you're an introvert, but you need excuses when people ask you to do things.
Yes.
And you're just so busy, so you can say,
I may have accidentally drunk bleach. So,
right.
You know,
sorry,
this is,
can't.
Oh, Robin, thank you.
And a fun little candle.
And a fun little candle. Which I love. Thank you.
You're welcome.
Smells like how do you pronounce that?
Say existential
crisis. Who am I? Why am I here? And why is this candle talking to me? Thank you.
It's perfect.
Oh, thank you.
Love you.
Love you too.
All right. So, Amanda, tell us a little bit more about the exercise for survivors.
So,
why are you so passionate?
Okay, well, first of all, exercise in cancer is a really big thing right now.
Okay.
There's been a lot of research done in the past couple of years, and there's a lot of things we know. We know that it can help prevent, that's the key word, help, in people actually getting cancer. It helps in, when you have a cancer diagnosis, it helps reduce the risk of reoccurrence.
Okay.
Exercise has been shown to help reduce side effects of your cancer treatment.
Okay.
Some of those, the main side effects.
During treatment?
During treatment as well. So if you have cancer, a lot of people, the main side effect people experience is fatigue.
Right.
And exercise has been shown to help decrease fatigue. It decreases nausea. It can help decrease blood clots. Some chemotherapy can really affect what's going on in your cardiovascular system, so it can help with that. Exercise can help with depression, anxiety.
I really like that thought, because we all know that for ourselves. But so why would it be any? I mean, you sort of think in your mind, well, if I'm going through treatment, I'm going to feel terrible, and it's most likely, right?
Yeah.
Not have much energy, so exercise is like off the table.
Yeah.
But you're saying, and you're seeing, that actually, and probably not like Olympic weightlifting or anything like that, but the exercise and the movement, what you see and what the research shows is that it actually puts you in maybe a more positive state. Yes,
it does. And so one thing, the guidelines for exercise in cancer are actually the exact same as the guidelines for anyone else out there. So 75 minutes of either vigorous activity a week or 150 of moderate. So as we know, it's hard for just your normal everyday person to get out there and meet that criteria or meet those guidelines. So when you're going through a cancer diagnosis, it can be even more challenging. So
having a group,
having a group setting is very important.
Really is smart.
And also, I think today we really have to take exercise, and I like to say, I like to throw that word out and use the word movement instead.
Me too.
It's about moving. And really breaking down your day and finding more time for movement. So if you are sedentary throughout your day, you're not feeling well, you're in treatment or out of treatment, trying to incorporate 2 to 3 minutes of movement each hour. So that can be really beneficial in decreasing those side effects and just for getting the blood flowing. Yeah. It adds a little bit for that social emotional piece. Yeah. Feeling good. So hear that.
2 to 3 minutes of movement an hour.
An hour.
Okay.
Yes.
And what we'll do is we'll post later a video of some ideas that people can do for 2 or 3 minutes of movement.
Yes.
And you know what? The great thing about that is, like, where my brain immediately goes is that's what I tell my clients all the time who are having back pain, knee pain, shoulder pain, hip pain, neck pain. We have to get out of this posture. And so you can't expect, like, I don't want people to do 30 minutes of their extra movement that I want them to do to make their pain go away one time a day. I want them to do it, like you said, a couple minutes here, a couple minutes there, maybe 10 minutes. But if you think about the ratio of time that we're sedentary or we're doing a repetitive motion, something, we have to counteract that time.
Yes.
With variety of movement, changing speed, changing the angles, changing all those things. And it's not that hard to do.
No, and you know, I always like to let people know that 2 to 3 minutes is different for everybody. For someone, it could be walking out to their mailbox and back. Someone else could be filling their bird feeders. It could be just going to the bathroom. It's doing something. That means it could be anything. It doesn't. You don't have to be wearing clothes to exercise.
No.
It can be anytime, anywhere.
Because so remove the barriers.
Remove the barriers.
You don't need
no barriers
weights,
to exercise.
You don't need to change your shoes. No. You can do this, and this kind of stuff you can do no matter where you are, no matter what you're wearing.
Yes. And then I'd like to touch a little bit on lymphedema and breast cancer. So that is the fluid building in the arm. So when the lymph nodes are removed, sometimes the body can't flow the fluid through, so it collects, and it can be really, it's really uncomfortable for many patients. I want to say mainly women, but men can get breast cancer as well. So they wear a sleeve, and when weightlifting has been also shown to have many benefits for cancer survivors. So in the past, after women would have surgery, they would say, don't use your arm, don't use your arm. And now we realize,
that
no,
didn't work very well.
It didn't work very well.
Yeah.
So now we move the arm.
I saw a lot of really swollen arms.
I bet, right? So now we just have to use it more in a systematic, methodical way. So I like to always say, start low, progress slow, and let your symptoms guide you.
So when you say start low, what do you mean?
Low weight. So 1 pound dumbbells or none. You know, you can do your weightlifting with just your arms. And what the research has shown is if you do things very slow, it's very hard for us to do that. We think, and slow means this week maybe I'm lifting 1 set of 10, say, bicep curls with a 1 pound dumbbell. And then next week, I'll do 2 sets. And then week 3, I bump my weight up to 2 pounds, but go back to 1 set of 10. And then I slowly build up, and eventually, weeks down, you know, weeks later, I'll be up to probably to 5 pounds. Now, if you have a setback, the research shows, you just go back to your previous amount of weight that you were using, and you cut back on the repetitions. And actually, this has happened to many of the...
You can help people figure it out, right?
Yes, and then most of the people I work with, this has happened to, and all you do is you go back, you know, you go back a week and you rebuild, and, you know, I have to say, some people come to the classes, come back because they love the social emotional support. This is their exercise class. They love it. But I also love working with people who I don't see anymore because they are back now. It might be a year, 2 years, 3 years later, depending on the person, playing tennis again with no problems, doing what they loved to do before, mountain biking again. And so that's what we want. We want people to get to where they would love to be.
So
it just takes longer.
It does take longer. And in a lot of things in recovery, so not just cancer, but recovering from surgeries and injuries, used to be kind of the standard rest. And we know, because we've been in this field a long time, that didn't work
No.
Yeah.
No. Right. It doesn't work.
Yeah, and it's okay to move.
It's okay to move, yes.
So I see one thing that when women have surgery for breast cancer, I see a lot of ladies, maybe a year or 2 years after, that are experiencing restrictions in their shoulder and their posture because of guarding here.
Yes.
And lots of, once we get your arm up and we're moving through all this tissue and all the shoulder blade, the thoracic spine, the neck, it's okay to bring your arms up over your head, right?
Yes.
And so that is something that is super important.
Oh, yeah.
I think.
Yeah.
Because if you're not challenging yourself, and we want to protect that area. It's scary.
Yes, it is.
Yeah. And so in the video that we make, we'll show a few ways to gently open up that and
area.
Get those arms up over your head for anyone. That is super important.
And we're sitting here talking about exercise, but really what we want is for people to get back to everyday living, being able to pick things up off the floor and be comfortable doing that and not getting hurt doing it, so they can resume what they consider a normal everyday life.
That's what it's all about.
That's what it's all about.
Yeah. That's what we know from our people here at BeFit. Like, the great thing about the people that come here and keep coming back here is they don't dread coming and doing their exercise here. They like it. Feels good.
Like it.
It's bright. It's cheery. We're pretty friendly, So the whole point is that, come spend a little time with us here so you can go do what you want to do.
Yes. And
doesn't have to be here.
And we all know, we all do what we like.
Yeah.
So find something you like and do that. Everyone, I have found in fitness and in exercise, everyone is always looking for the right thing to do. And it's not necessarily about the right or the best. It's just about doing something and doing what you like, because the more you enjoy it, the more you're going to keep doing it. Yeah. And that's when you see the results.
Yeah. The only way to get consistent with something is if you like it, and if it feels like it's doing something beneficial for you. Otherwise, why would you do it? Right? I wouldn't do it.
I wouldn't either.
All right, so what else is on your mind? What do you want people to know?
Well, if I had to leave you with...
This is probably good. Okay. But we'll go as long as you want. All right. Yeah. I want you to get out what you want to get out.
All right.
And if we don't get it all out, we'll make another one.
Yeah. All right. Yeah. Well, if I had to leave everyone with 3 things, it is Breast Cancer Awareness Month. So get your mammogram. Yeah. They say over the age of 40.
How often?
Well, once a year. If you have no history, family history, then you can start your mammogram over the age of 40. And if you do, I'm sure you're in touch with your GP or your gynecologist, and they can help direct you to when to start that based on your family history.
So one thing I learned yesterday was I should have called ahead and got my films from the first one I had before I moved here.
Yes.
Because the technician said mammography, is that the right?
Yeah.
Okay, is all about comparison.
Yes.
And so you want to have a series of baseline comparisons, right? So
just see how it evolves and the tissue evolves over.
Right, because we all have, different tissue.
Yes.
And so that way, if you go consistently, this is what I'm learning, if you go consistently, then it's not as scary.
No,
and they're able to say, well, yeah, this is normal for you. So see you next year.
Yes. Yep.
Whereas it takes a lot of the worry out.
Yes, it does.
Yeah.
They know what they're looking at.
Yeah.
2 is get to know your breasts.
Oh. Okay.
Yeah. A good rule of thumb is maybe the first of the month, give yourself a self-breast exam. But like Robin was just saying, with getting a mammogram, it's the same with yourself, is feeling where some people have more lumps and bumps than others. So really getting to know your breasts and knowing what they feel like, so you're comfortable with them. And then that actually, some people are really nervous.
Yeah.
they're nervous that they might find something, so they don't give themselves an exam at all.
Procrastination has a lot to do with fear.
Yes, right.
In anything.
Yes, completely. And then third is to find a nice support network, regardless of if you are a survivor, but finding that comfort in that care, someone to go with you, someone to maybe hold you a little bit accountable, a buddy to make sure that you keep your health. You know,
put it in your schedule.
Put it in your schedule.
Have people, if you're people, you know, it is nice to have support.
Actually, can I change my third?
Yeah.
My third is to start moving more.
I love it.
Yeah.
How about we make it 4?
Yeah.
So 1 was get your mammogram.
Get your mammogram.
2 was get to know your breasts.
Get to know your breasts.
3 was support. And 4, I think 4 is important.
Yeah. Start moving more.
Start moving more.
Yeah. And whether it's 2 to 3 minutes, once more a day. For people who are already moving, how can we all move a little bit more in our day? And it can be anything.
And people who are already moving, like you might say, well, I already go for a walk.
Yes.
Or I run, or I ride my bike, which is wonderful. Don't stop doing that.
Yep.
But too, with with your life, that it's important to break that up a little bit, change it up a little bit, and not just run 700 miles a day.
Right.
But to change your movement.
One thing I just recently started doing, instead of getting my mail through my car when I pull up, I now drive into the garage and walk out to my mailbox. Because that little break between getting home with all the stress and crazy and walking just down my driveway, which isn't very long, and back it's created, gets my blood flowing, I'm out in the fresh air, and I feel like I can reset. And there's the mind, body, spirit, part there.
That's huge, guys. Little things like that. Because, Amanda has 3 little boys at home. I don't know why I said 4, because we just said 4.
Right.
3 little boys at home. So it's important to reset before you walk in.
To reset to the chaos.
So. And then maybe pretend you didn't get the mail and go back out a little bit later. All right, so I think what we should do is, this will be on a different video. We're going to do a little movement. Yeah,
sounds great.
I think we should rope Caitlin into a little discussion. And also maybe Trevor.
For No Shave November.
Yeah. Perfect. All right.
Honoring prostate cancer.
Right. The guys are important too.
Guys are important too.
All right. So thank you guys for watching, and Amanda, thank you for taking the time.
You're welcome. It's been fun.
And anything.
Me too.
Okay. All right. Oh, I have to say one more thing. So the new BeFitNow group on Facebook would be a great resource for anyone.
Yes.
Survivors, anyone, to just get a little daily dose. We do a BeFit 10 and 10 every week. So there's. Well, you'll do the next one.
Yes. Oh, I can't wait.
Okay. So that's 10 exercises in 10 minutes, 10 moves in 10 minutes. We put that up every Wednesday. So you could, if you do 10 minutes a day, you're like going to be way ahead of you. And then the other thing is we put some kind of mindset things on there. We put these kind of talks on there, but I'll put a link to that on this video.
Great.
Okay?
All right.
All right. Thanks, Amanda.
You're welcome.
All right. Great job.